Okay, good morning, everyone. Dr. Randall Gates, board certified chiropractic neurologist, also a chiropractic physician at Gates Brain Health. Many of you would consider what we do as functional neurology. What is functional neurology? It's basically taking someone with a brain-based condition and executing rehab strategies or trying to correct their diet or their nutrition or their supplementation for their brain to function optimally. Now, for everybody on Facebook, just know we are doing this live on YouTube as a PowerPoint screen presentation presented by the wonderful Melanie again. And so it may be best if you jump over to YouTube, but if you don't want to do that, we're going to repost the full screen onto Facebook. So we're talking about genetics and childhood anxiety because this is a question that commonly comes up, as I discussed earlier in the week, about my patients who suffer with depression, and they say, I'm concerned about my child perhaps developing this, and what are the odds, and what are the other factors that I need to be attentive to. So here, we're going to go through a few slides. I'm also going to pull a few articles from my computer, so you'll see me looking around a lot, but that's what we're going to do. So I think something that's really important just to look at is in the discussion of a child who has anxiety. Because I talk to a lot of people and they say, I had a really good life, I wasn't stressed, and then all of a sudden, I developed anxiety when I was 5, and there was no trauma, there's nothing I can remember, and I've been anxious ever since. So that's one story I hear of. I also hear of other stories where there was what many would consider horrific trauma and awful circumstances, and those individuals may have anxiety too. And sometimes those individuals don't have as much anxiety as someone who doesn't have trauma. So how do genes and environment interact is a big question right now in the literature, particularly since the genome was sequenced around 2000. And with that, we also have to look at what was going on with the mother when she was carrying the child in utero. So that's another really big thing we want to pay attention to. And this is an article that I was looking at last night where they said exactly that. They basically said maternal prenatal anxiety and child COMT genotype predict working memory and symptoms of ADHD. So what does that mean? What is COMT? You've heard me talk about COMT before, and COMT stands for catechol-O-methyltransferase. It is an enzyme that breaks down dopamine, norepinephrine, and adrenaline. In the psychiatric literature is particularly discussed relative to dopamine. So you may know that they give ADHD children drugs like Ritalin or Strattera. So they give these, Adderall is another really commonly used one. So they give these kids dopamine-based medications or norepinephrine/dopamine-based medications because the hypothesis is that they don't have correct amounts of dopamine, and by giving them those meds, then they're going to get enough dopamine in their prefrontal cortex out here, and in doing so, that's going to allow them to pay better attention with their dorsolateral prefrontal cortex, cortical areas as seen here. So here they're talking about the state of the mom carrying the child in utero, and if she has anxiety combined with that child's COMT genotype, that can affect that child's working memory as well as that child's symptoms of ADHD. Super, super, super interesting. Because lots of times, moms and dads are trying to do the best they can for kids, and life is life, and sometimes moms are stressed out. I've heard of bad circumstances there where, the mom is 6 months pregnant and the father leaves, things like that. That's very, very, very stressful. So all that plays into then how the brain of that child combined with their genetics develops. Now going into COMT in a little more detail, let me just take a sip of water. COMT basically denotes how fast we're breaking down dopamine. There's something called MET-MET, and there's something called VAL-VAL. The VAL-VAL genotype basically means that you're going to not break down dopamine you're going to break down dopamine excessively fast, whereas MET-MET basically don't break down dopamine. So let me say that again because it's inversely related. So the MET-MET genotype, they have high levels of dopamine because they're not breaking it down. The VAL-VAL genotype has basically low levels of dopamine because they're breaking it down so quickly. So some have said now that this ties in with what's called the warrior versus worrier endophenotype. So individuals who have low dopamine, lots of times when they get into a stressful situation, then that stress will elevate their dopamine levels because it's typically low because they break down dopamine so fast. So it'll elevate their dopamine levels and then they'll rise to the occasion. Whereas the MET individual who has high dopamine because they're not breaking it down because of low COMT activity, then their dopamine levels are already high. So if they get in a stressful situation, their dopamine levels go even higher. And too much dopamine is bad for the prefrontal cortex, as I've said in previous broadcasts. Dopamine is like Goldilocks to the oatmeal. You don't want it too hot, or excuse me, too cold. You don't want it too hot. You want it just right. So that's what we're seeing. And these are just different graphs from this article, or anybody who wants this article, I'm happy to present it. But here they talk a lot about working memory and basically ADHD based on the mom's stress and her genotype and the genotype of the kids, more the genotype of the kids. Now this is a really interesting article because, and for everybody on Facebook, just so you know, we're doing this on YouTube live as well with the Screen and Screen PowerPoint. So we're going to repost it to Facebook. But in this article, it's titled "The Warrior COMT Val-Met Genotype Occurs in Greater Frequencies in Mixed Martial Arts Fighters Relative to Controls." So for anybody who watches, like, what's it called? The UFC. If you watch the UFC or some other Bellator, MMA type fighting, they've gone in, they've actually studied the fighters, and they showed that the champion fighters, not just the regular guys who are at the gym fighting the gym, but the really, really good fighters tend to be Val-Val, whereas healthy controls tend to be more Met-Met or Val-Met, meaning the mixed martial arts fighters who are really successful, they tend to have lower dopamine when they're at rest, but when they get into the fight, that fight surges their dopamine, it increases their awareness, increases their reaction time. So it's like they're right in the sweet spot. So this was a super interesting study. Came out of, Southeastern University in Florida, Nova Southeastern University in Florida. So pretty interesting. But another way that our genetics interact with our environment. Okay, so we're going to go down a little bit more. Here are some of the characteristics of this. Now, at this point, I'm going to draw on some articles. This one is from Genes, Brain, and Behavior, where they said the interaction of early life experiences with COMT, Val 158 MET, affects anxiety sensitivity. So in this article, they were discussing that if you look at a child's genetics, because if a kid has anxiety, why do they have anxiety? Maybe they have trauma, maybe they don't. But they said the kids who have the COMT genotype, and also there are kids who have trauma who don't have anxiety. So they said the ones who are MET basically with the COMT phenotype, and then combine that with MAO polymorphisms, which I'll talk about in a second, that these were kids when exposed to trauma were much more likely to have anxiety. MAO refers to monoamine oxidase. The MAO enzyme you may have heard of 15 years ago when they were advertising Prozac on TV, and they'd say, don't take this if you're on an MAOI inhibitor or an MAO inhibitor. So the MAO enzyme was one of the first ones discovered relative to depression because it breaks down chemicals like serotonin, norepinephrine, and dopamine, similar to how COMT more selectively breaks down dopamine and norepinephrine. So the MAO enzyme is also really important because if it's excessively active and it's breaking down all of your serotonin, then you're going to be more likely to feel anxious. And that's exactly what's been shown. And then let me just pull up a few other articles here. This is from the U.S. Department of Veterans Affairs, and they said the COMT Val 158 MET polymorphism links to altered fear conditioning and extinction are modulated by PTSD and childhood trauma. So here they looked at guys with PTSD, and they in essence found that the ones who had childhood trauma and the ones who had the COMT MET polymorphism were more likely to have PTSD. So this is all super interesting. I mean, just relative to why one child may develop PTSD and one doesn't, it may really relate to how they're breaking down adrenaline and dopamine, because for those MET carriers, sometimes their adrenaline levels can be 4 times as high as someone without the MET polymorphism. So seemingly trivial circumstances can be more stressful for that person, and really stressful circumstances can be exceedingly stressful for this person. So for you mothers out there, for those of you concerned about your kids having anxiety, this is something really important. I'm basically recommending that all of my child patients who have anxiety disorders be tested for serotonin polymorphisms, the whole MAO thing, COMT polymorphisms, BDNF. We want to look at all of these genes to really figure out why this child has anxiety, particularly in the absence of really bad childhood trauma, which I know is subject to the interpretation of whoever's talking about it, but you know what I mean. Really severe cases of childhood trauma certainly can cause anxiety, but maybe some individuals have that and they're not as anxious. So that's where genes and environment particularly interact. And I think that's pretty much the broadcast. Let me see if there were any other articles that I wanted to. We talked about this one. Talked about that. And yep, and we talked about that. So if any of you have any questions, let me know. But again, if you have a child with anxiety, these are the factors to consider. And I'll be happy to get back to any questions you post on Facebook or YouTube. And I hope you all have a wonderful Saturday. I hope it's a proportionally calm and relaxing Saturday, given all of the current events going on where people are being recommended to socially distance and stay in their homes. Today, I think I'm going to try and do some push-ups to, do my workout since the gyms are closed. So anyways, I hope all of you stay healthy, and we will talk to you soon. Let me end this.